Hi, Dr. Patch Adams, here to discuss scoliosis with you guys. Now, work with me on the Patch Adams Nose. There's going to be some 11 and 12-year-olds that are going to want to watch this video so they can straighten their scoliosis curves with these at-home stretches and exercises. So let's just get right into it. And getting that diagnosis of scoliosis at the age of 14 is not fun. I had to wear this huge, ridiculous brace 23 hours a day, even while I slept, called a Milwaukee brace. This brace cut into my armpit and actually caused a lot of neck pain for me while limiting my movement and my range of motion. I later found out, as I got my doctorate in chiropractic, that was not the correct approach. Don't get me wrong, if you have a curve over 24 degrees, your options are limited. But an active brace is much better. In defense of the orthopedist, they didn't have soft active braces back then. So I had to resort to chiropractic care and Schroth exercises, which we're going to go over today, to correct scoliosis. Not a brace. That doesn't mean there aren't good braces out there for people with a scoliosis curve over 24 degrees. I'll leave the links below for those active braces. Now, 85% of all structural scoliosis cases have no known cause, hence the name idiopathic scoliosis. Idiopathic scoliosis occurs in 2 to 3% of the adolescent population. It commonly affects females from the age of 10 to 14, while boys' growth spurt is a little later on, affecting them from ages 12 to 16 typically. The incidence of idiopathic scoliosis occurs equally in adolescents, in both male and females, for smaller curves less than 10 degrees. Any lateral curve less than 10 degrees isn't typically considered scoliosis. But hang on, these stretches will still help you. Larger curves and a curve progression are much more prevalent in females. In contrast to idiopathic scoliosis, there are several less common types of scoliosis that have a known cause, such as muscular disorders or curves, could be present at birth in some rare cases. Typically, the earlier it's detected, the more likelihood of it progressing. There are two general categories of scoliosis: structural and functional scoliosis. Structural is by far the most common category of scoliosis. There are several types of structural scoliosis. Now, structural scoliosis involves spinal rotation along with a side-to-side or lateral curvature of the spine. This type of scoliosis affects the spine structures and is considered permanent unless the spine is treated with chiropractic, bracing, postural training, physical therapy, and Schroth exercises, or any combination of those therapies just mentioned. The second category, functional scoliosis, also known as non-structural scoliosis, develops secondary to another underlying cause. For example, postural imbalances or weak muscles, a short leg. The short leg being the most common reason. I've seen short legs diagnosed in many different ways, and visually done by x-ray and digitally measured is the best and most accurate technique to measure a short leg. If a person with functional scoliosis were to bend forward or lay down, the hump would likely go away, whereas someone with a structural scoliosis would not see the hump correct when bending forward. All right, let's get down to the nitty-gritty. There are 4 essential scoliosis curves or patterns that we typically see. Number 1, the most common, is the right thoracic curve, usually accompanied with a right rib hump or a muscular prominence on the right side, and an elevated right shoulder, and also possible winging of the right shoulder blade, where the shoulder blade pulls away from the back rib cage. In some cases, it can come with muscle prominence in the lower left back. The second type or pattern we see, also fairly common, is the left lumbar curve, which accompanies a left lower hip and the center of gravity shifted to the child's left side. The third pattern that we typically see is a left thoracolumbar curve. This type of curve is seen with a left-sided muscular prominence in the lower back. And then the fourth pattern we see is a right thoracic left lumbar curve. This is a double curve and may be undetectable due to the balancing of the posture. We oftentimes find a pronounced waist curve on the right side and a flattened one on the left side. A proper screening process is crucial for early detection of scoliosis and can be missed easily because most cases are not painful the first few years when it's developing. In many milder cases, the subtle postural changes can be hard to notice. During our Synergy scoliosis correction protocol, we use orthopedic tests, visual assessment, a scoliometer, and surface EMG to read muscle imbalances. If 2 or more of those tests come back positive, we then use digital X-ray, which is 30% less radiation, to measure the curve using the most common method, the Cobb angle. For structural scoliosis cases, a mixture of chiropractic and Schroth technique exercises and stretches are the most effective when done consistently and together. If the curve is over 24 degrees, we do recommend an active brace, as I'm going to leave those links below, chiropractic and Schroth exercises and stretches along with that brace. If you think you or your child has scoliosis, don't wait. Early detection is key. Get them examined by a scoliosis specialist like myself. We offer scoliosis screenings for children and adults at our New York City location in the East Village of Manhattan. I'll leave the links below to schedule a scoliosis screening. Now let's get into a couple of stretches that are going to help you with your scoliosis. These stretches are stretches and exercises that you can do at home to straighten your scoliosis curve. All right, scoliosis sufferers, let's get into it. This is all you're going to need, a towel. Please tell me you have a towel, okay? If you don't have a towel, well, somebody may stink in the house, okay? So, you're going to take this towel, you're just going to use this for your stretches and exercises, right? Every day. Okay, so here's what we're going to do. We're going to take this towel, we're going to just open it up, spread it out here, then we're going to fold it 3-way. And these are some of the stretches. What I'm giving you is the stretches that I use to straighten my scoliosis out. Just kind of perfected them over the years and the exercises. So we're going to go over 3 exercises and 3 stretches for scoliosis. Now that we have it folded 3-way, the long way, we're going to just give it a nice tight roll here. All right. Takes me a little while here. I'm not the best folder. You should see my laundry. It's just all wrinkled. Okay, don't worry about the wrinkles. Doesn't have to be perfect. And after you get a nice tight roll, you're going to take 2 rubber bands, because again, you're just going to use this for your scoliosis exercises and stretches. And you're going to do it every day, right? So, when I say that over and over again, you're going to do your exercises every day. Well, the reason I do that is because consistency is key. Consistency is everything with these stretches and exercises. I can't stress it enough. So let's go ahead, let's get into the 3 stretches and 3 separate exercises for scoliosis. Priscilla here, who has allowed us to show how we stretch and how we exercise a left lumbothoracic scoliosis. And before I went over the variations of scoliosis. Now understand that you have to be seen by a professional, have x-rays done to diagnose scoliosis and to know exactly the angles of your curves, the degree of the curve. So don't try to guess this. This is somebody that has had x-rays, it's had it diagnosed. She has a left lumbothoracic scoliosis. So what does that mean? Here's the spine, here's the left side, here's the right side. So a left lumbothoracic scoliosis is in this region right here. This is the lumbar spine, these 5 vertebrae here, and then these 12 vertebrae from here to here is her thoracic spine. She's got scoliosis, a left scoliosis in the lumbar and the lower to mid-thoracic region here. We've been working with her for a long time. Her spine has improved greatly. So you don't see the curve that much, but there are people that have a right curve. There are people that have a left lumbar curve and a curve up here on the top, a right curve, which I spoke about earlier. She just has one curve. So some of these stretches can be modified, and as we go through the exercises and the stretches, I'm going to show you how you can modify it if you also have a right thoracic curve on a few of them. If you have any questions, you can certainly comment below on the video and ask us, because again, every case is different. It just depends on where your curves are and the degree of your curves as well, okay? So we use a couple of different items. We have this thing which is called the Scolio roll, and we use this on bigger people, guys my size and bigger. I'm 6'1", so you know, even like 5'9", 5'10", we use this in the lumbar spine. I'll leave links below where you can get these if you're interested, but you can also just use a towel for this purpose here. Okay, we're going to start off with 3 exercises. The first exercise helps the core, and you can go ahead and get on all 4s. So you'll get on all 4s, and this exercise helps to build the core, and you want to make sure your back is flat, your shoulders are over your wrists, and knees, your hips over your knees, and knees shoulder width apart. And go ahead and raise your left hand out, straight out first, and right leg. Good. You want to hold for 3 seconds and down, and you're going to switch arms, right arm, left leg. Good. And what this does is it helps to build the lateral stabilizing muscles in the spine, as well as your glutes, all the core stability muscles. This is a great exercise, and you'll do 10 on each side, and I like to do about 3 or 4 sets every morning. And again, you want to make sure the back is flat. Good. Okay, and one more there. And when you do this, you want to elongate. So you want to elongate the toes this way and the fingers and hands that way, and really elongate the spine. Okay, you can relax. And now we're going to go into side plank facing this way. So since she has scoliosis, if you go ahead and lay on your side for me. If you were to look at her scoliosis, remember I said it's a left curve, so it kind of does this, right? I'm exaggerating it a little bit, but it does this. Now, when you have scoliosis like that, and curve, a left curve, the concavity is on the right side, because the curve is like this, like a bowl almost, right? So it's a concavity here, and on this side down here is the convexity. So what we want to do is we want to make sure that when they're in this side lying position, that there's some support underneath the convexity, okay, opening up the concavity. And I'll show you here. So come up just a little bit. We're going to slide this underneath. Good. And lay down there. Good. And we're going to bend this top leg. Yeah, just like that. Okay. Now, in this position, we're going to do just a side bend. We're going to just relax there. Now, this is one technique I do for patients, and I have them lay here for up to 18 to 20 minutes a day. You build up to it. You start out at 3 minutes, go to 5 to 7 to 10, and build up to it. Over about a week or two it takes to build up to that. You're going to be sore in the beginning, so that's why you only do it a few minutes in the beginning, the first few days. But this helps to correct that curve. And again, if you have a left scoliosis, you would lay or put the towel, the rolled up towel, underneath the convexity. And then we want to open up the concavity. So she's going to straighten this leg out and stretch towards this way. And then she's going to take her arm this way and stretch out. We're going to open this up. And we actually open up the concavity right here. Good. And breathe in. And exhale and tighten the core. And breathe in. And stretch as you breathe in. Good. And exhale and tighten your abs. And breathe in and stretch. Good. And exhale and tighten the core. Great. Now from this position, and again, build up to 18 to 20 minutes. This should be done every day. This was one of the key stretches that I did and exercises with the breathing in and out. Don't forget the breathing in and out. You breathe in, you stretch, you exhale, and you tighten your core. Okay? And now we're going to go into, I'm going to slide this out here. Okay. Now we're going to go into a side plank. So she's going to go ahead and bend the knees, and you want to make sure you're in a straight line. So you're going to bring those knees back. Good. And we're going to go ahead and go into a side plank. Good. And you want to make sure that, I like to put my hands here on the hip. Yep. You want to make sure that when you're doing this that you're in a straight line here. Okay, if you're dropping down, that's not good. Okay, and also you want to make sure that you have the right side up. Okay, so we have her concavity up because these muscles are tight here on the right side. So we're trying to open that up. So by doing a plank, a side plank, she's really working more on the bottom muscles to strengthen those, more so than up here. So that's why we're doing it this way. If you had a right scoliosis, a lumbar scoliosis, you would want to do this on the other side. Again, you want to do this with the concave side up and the convex side down. Okay, and you do about 10 of those, 3 sets of 10. Go ahead and do one more for me. And if you want to get a little more advanced, you do the legs straight instead of the legs bent. Yep. And a nice, great straight line. And you want to make sure your shoulder is right over your elbow, just like she has it here. And you can relax there. Okay, great. Now in the side lying position, she's going to do some leg raises. So go ahead and raise the leg up. And you want to stretch or point the toes out that way and stretch this hand out this way. Now, hold it for 3 seconds and down, and again, and you're going to do 10 of those, okay? Now, if you have a double curve, like I spoke about before, so a left lumbar or a left lumbothoracic, and then a right thoracic curve up in this region, you should be doing this. Touch your AC joint right there, and you should be doing that with your breathing exercises. And that'll be part 2 of our scoliosis Schroth stretches. But this helps to push the shoulder blade and this part of the spine from the right back down to the center. So again, if you have a double curve, you want to put your hand on your AC joint, elbow pointing straight up. If you don't need to do that. Like her, she doesn't have an S-shaped curve or a double curve. So one more, raise the leg up. Good, and point the toes out that way. Good, and elongate the spine, elongate the arm that way. Good, and hold down. And now we're going to do circles. Okay? Great. And while you're doing this, you want to make sure you're elongating the spine. And sometimes, what we'll do is we'll stabilize the pelvis here and open up this concavity right here. Good, and reverse circles. Good. Okay, now we're going to do a clam. So you're going to keep your ankles together and open the leg up. Good, and that'll work the glutes. Great. And you can do 10 of those, 3 sets of 10. I'm big on 3 sets of 10 of everything. If you want to push it another step further, you can do 4 sets of 10. Great, and then we're going to do a clam and then extend the leg. Yep, and bring the ankles back together. Yep. So you're going to do a clam, extend the leg, ankle back together, close. Good. Now if you want to make it really hard, do all of them together. So do the leg raise, hold for 3 seconds, do 10 of those, go right into the circles, go right back and do 10 of those, go backwards and do circles backwards, do 10 of those, do 10 clams, then do 10 more clams with the leg extension if you want to do them all together. But for beginners, you can break them up 1 set at a time. Okay, all of this should not take more than 20 to 30 minutes a day. But these stretches and exercises are really meant to correct your scoliosis, not just to make you feel better. Okay, these are corrective stretches. Now, we're going to go into a lumbar mobilization exercise, so go ahead and lay on your back. So now that we've done all the exercises, let's go into some stretches, some flexibility exercises. You want to lay on a flat surface. You do not want to do this on a bed. You can do it on the floor, on a yoga mat, or on a carpeted floor, more comfortable. And what you're going to do is slowly, vertebra by vertebra, each spinal segment, you're going to flatten it down to the table, yep, without moving your this upper half of your body. And you're going to come back up. Good. And vertebra by vertebra, drop it down flat to the table. And then come up vertebra by vertebra. Okay? It's a nice, slow, deliberate motion, and you're going to do 3 sets of 10. Okay? And just do a couple more for me. Good. And 2. Good. And 1. Good. Okay, now we're going to do a stretch called threading the needle. Go ahead and turn over and on all fours. Okay, so threading the needle is really good for people that suffer from scoliosis with rotation in the spine. We spoke about rotation in the spine with certain types of scoliosis. And when you have rotation, this can really help for the thoracic area. So we're going to take the right arm and go through there first. Okay, good. And you just want to get a nice, good twisting stretch right in there. Okay. And again, you could probably do this on your bed as long as it's not too soft. But really easy to do this on a bench if you're at the gym, if you have a gym membership, or again, a firm bed. You can do this on the floor as well, right, on a yoga mat. Good. And you want to hold each stretch for about 30 seconds. If you feel really tight to one side or tighter, rotating to one side, you can spend a little more time on that side. Again, I wouldn't do more than about a minute of the stretch. I would come out of it and then take a break and then go back into the stretch. So 30 to 60 seconds max there. Good. And is it tighter on one side for you?
All right.
Your right side, okay. Okay. This stretch is a side bending stretch. You can do this a lot of different ways. You can do it on a physio ball, just sitting on the physio ball, doing a stretch like that. You can also, instead of sitting on it, lay on the physio ball. So it's underneath your lat on your side, and you lean over it. But it's important to understand where your scoliosis curves are. This is why I'm reiterating, you need to get an x-ray to diagnose the severity of the curve and where the curves are, and preferably a full spine x-ray. Now, as we said, she has a left curve, so we don't want her bending this way, like this. That's going to make the curve more enhanced. It's already curved like that, right? So what we're going to do is we're going to have her raise this arm, okay, and she's going to stretch. And then also in this stretch, not only is she opening up the concavity, right? So because she has a left Here, straighten out here for a sec. Since she has a left lumbothoracic curve, her concavity is here, her convexity is here. So raise your arm up and drop this arm down if you can there, and you're just gonna lean, and we're gonna, again, open up this concavity over here, okay? And you hold that stretch for about 30 to 60 seconds, and you can also feel it in your psoas muscle in the front a little bit as well. All right, so another way to do the side bend, I said the physio ball. Another way is in the door frame. So you're gonna go ahead and grab, in her case, she's gonna grab the left door frame, and again, opening up the concave side, okay, and leaning towards the convex side of her curve. You hold that for 30 seconds to a minute, and that's a great stretch for scoliosis. I hope you guys like this video. Please give us a thumbs up, subscribe, and hope to see you soon with some more scoliosis videos to correct your scoliosis curves.